Welcome back to a brand new episode of Private Parts with me, Liv Bentley. This is the podcast where nothing is off limits. And this week, we've got a very special guest who knows more about turkey teeth than most people. And that is Dr. Sam. Sorry, I should have said dentist Dr. Sam.
Yes.
And he's legit, and he's not from Turkey. Can we say that? Welcome to Private Parts.
Thank you for having me, Liv.
I'm excited about this because teeth seem to be, firstly, everyone owns them, but everywhere. How has it become the biggest thing?
Yeah, as in it's all over social
it's
media. It's like everywhere now. So your smile is not just something you go to just get fixed. It's now something you choose to fix.
Yeah. It's aesthetic. Is aesthetic the correct word for that?
Yeah.
Yeah, it is.
Yeah, aesthetic dentistry is now massive.
It's huge. I mean, coming from the bird who's sitting here with Invisalign in, so if I have a slight lisp, I am sorry. / spit on you. I'm joking. I try not to.
That's good.
Yeah, that is, she said that. I didn't appreciate that because I went to go see sweet Dr. Rona, who's doing my teeth, and she said, "God, you actually really are wearing them. What's the point in doing it if you don't wear them?" Yeah, she was a bit. And I showed up to a premiere last night, and my friend goes, "You're not going to take this out?" And I thought, nope. It's like the quicker the better, these guys.
Yeah, I think it's like that thing works when it's in the mouth, and if it's not in the mouth, it just doesn't work.
Yeah, so, I like things in the mouth. I'm joking. We can make this so weird and sexual. Okay, right. So, was it always you always wanted to be a dentist?
Yeah. So that's also a strange thing. From the age of about 11.
That's niche.
Yeah.
What were you watching as a child?
Yeah, like teeth videos. No, I think. Do you remember 10 years younger? Back in the day, back in the day, that was always really cool to watch.
Yeah.
And the teeth bit, I was like, wow, that's the best bit.
Yeah.
And then I wasn't exposed to many different careers, I guess, as a kid in terms of what my parents' friends did, which is all you would kind of see, really.
Yeah.
And the guy who was a dentist was probably having the nicest life.
Really?
So I thought maybe that would be good to do. And then it stuck with me. And then I met other people who were dentists and I saw like, okay, there's a creative element to it.
Yeah.
Because you are kind of using your hands and stuff like that. You can create your own brand and have a vision that's your own.
Yeah.
Whereas if I was a medical doctor, I'd be pushed to do what hospital wants me to do, right?
Yeah,
there's like a structure. Whereas there's freedom. And for me, it suits me.
And so do you specialise in more aesthetic stuff or more, what's the other word for it? Medical?
I guess we've got...
Essential.
Well, I think even the aesthetic work is still health related.
Yeah.
Right? So a lot of the people that come in for us, we do only cosmetic and I would say reconstructive dentistry. So that's moving teeth, making them look good, rebuilding them if they've worn down, essentially. Like that's what we deal with. And all of that is linked to confidence, ultimately.
Yeah.
So anything that makes people feel better about it, of course, that could be there's someone in pain or there's a bite problem. But usually if we're making something... we're fixing something, we're thinking, how are we going to make it look really, really good?
Yeah.
We don't go out of our way to make it look bad, right? So really every dentist should be aiming to be an aesthetic dentist of some kind.
Yeah.
But yeah, our clinic focuses on
because you never
that.
really thought about that. I mean, when I was younger, obviously not when I was younger, I didn't really think about it, but like having braces and stuff was more just an essential thing.
Yeah. Well, yeah, it is. But now we see so many adults like yourself.
Yeah.
Like, after having had braces as a kid, teeth move, and then now you're doing it for aesthetic reasons. But because of the aesthetic change, there'll be a functional benefit. So your bite will be better, you'll chew better.
Yeah, because I think I don't know. Yeah, I shouldn't really do that gurning thing. That's not me saying gurning, but because I think my jaw's more like that. But this is a weird one. Teeth linked to certain bodily aches. Is this a thing? Because I have heard people have certain teeth removed and the ache has gone.
Yeah.
What?
I think it's difficult to be precise about like that tooth is linked to that.
Yeah.
There'll be someone who knows about that I haven't really looked into.
Yeah.
But I think what we do know, and I know for sure, because I specialise a lot in teeth. Well, my special interest lies in bite issues. So I deal with a lot of stuff that people have worn down their teeth, as well as cosmetic.
Grinding.
And, grinding of the teeth.
I get the Botox in there to stop it. Well, now I've got these in, but...
So, which might be making you clench a little bit more sometimes when you have them in, especially overnight.
Yeah, I do that. Is that really bad to do? Rub them together?
If you do it, and then afterwards you can sort it out. But the Botox in the muscles we're doing a lot now. The grinding stuff is a big issue, and that can cause neck ache, shoulder ache.
I wake up like this.
Yeah.
Why am I going to bed so tense? I should be happy. I'm single. I'm 30. What's going on?
Maybe that's why.
Maybe that's why. Exactly. But they say that we are the happiest people. Bollocks. My gum says differently.
So yeah, aches can be all to do with that. And also there's a lot to do with like balance and if you chew on one side of your jaw, then maybe that's a stronger side and the other side gets weaker. It's to do with which leg you put forward first. And there's all sorts of stuff that we're not particularly hot on in the UK, actually, but it started.
It didn't even cross my mind that that's a thing.
Yeah, it all starts with muscles and jaw. It's just another part of the body, so it would be. And that's why sometimes we do something called facially driven assessment. So when a client comes to us, the first thing we look at is their overall face, because we don't want to create something that looks bad, right, in their face. Our whole thing is harmony. And we'll notice that one side of the face usually has got a bigger muscle and a bigger shape than the other side. And it's because they're using that side more. Like you're working it out, right?
Yeah.
In the gym on that side with your jaw. And so we try and balance it so that actually they can get more facial asymmetries resolved as well. So yeah, it does.
And can, if you have wisdom teeth removed or teeth removed, does it change the shape of your face?
In general, taking out wisdom teeth will not do that because wisdom teeth are really far back.
Yeah.
They're quite in generally. So it wouldn't really change
What
the
is the
shape
point
of your
in them?
face. Yeah, nothing.
Because they're highly irritating.
They're
I've
the
got one
appendix
fucker
of the
left
mouth.
on the top, and it's so irritating. And the dentist took all three out apart from this guy, and now he's poking through.
Yeah, well, it might come through and you might be fine. And it might be just that you're teething, right, at this age.
My age. No wonder I'm gurning. Gurning, I can't do that. I have a rather...
I'll give you a myth, right?
Yes.
There is a myth that your wisdom teeth come out and then they move your other teeth. People say...
Okay, so that's a lie, or that's...
Yeah, it's just not true.
Oh, well then why the hell did I have mine out?
Well, there is a benefit to having them out if they're causing problems. Like they can cause decay to the teeth in front, you can't clean them, there can be pain, all that stuff. But if you think about it now, it sounds crazy that we ever thought that. A wisdom tooth is one tooth. It's got to move, like all these guys in front of it.
Yeah.
On that side and that side. It's just not going to happen.
Can I just say your teeth are perfect? And I know that's a weird thing to say because you are a dentist. I have been to dentists with really shocking teeth, and I looked up and I thought, I'm not in the right chair. Sorry, but okay, so fine. So they don't move them around.
No, and what it is why it was always thought to be the case is because it just happens at around about the same time. So the age we get our wisdom teeth is the age where our jaws slowly start narrowing over time. Our teeth get more and more crowded. So if you fast forward, like all of us, fast forward 20 years, our teeth would be way more crowded if we didn't wear retainers and stuff like that than they are now.
Yeah.
And that process starts around about a similar age to when the wisdom teeth come through. So it was always thought, oh, your wisdom teeth coming through, crowding.
Got you.
But it's not, because we see crowding in people's teeth even if they don't have wisdom teeth.
I have been told by a dentist that my wisdom tooth was to do with crowding. So
yeah.
dodgy.
Well,
They've been to a dodgy dentist.
It's not that maybe they're dodgy. It's just like we learn things as time goes
yeah.
on, right? And so now we know that isn't the case.
Do you what do you notice in trends with teeth?
I hate trendy teeth.
Trendy,
by the way.
but what is a trendy tooth? Hey there, have you ever looked at someone and go, "Cool, he's got trendy teeth"?
You know, there's certain things that we can do that are non-permanent, right? And we can follow trends in that. Like, okay, this is cool fashion right now. I'll follow that. But when it's your teeth, there's one set of teeth.
Yeah.
And so I'm just not into the trendy personally. We don't do that.
Okay, so can we talk? Let's talk through this. Those gravestone-looking puppies, veneers, those.
Yeah.
To get a veneer on, you shave the natural tooth down. Is this right, or is that wrong?
Okay, so let's talk about that because that's something that is. We exist to kind of help people understand that things are different now.
Yeah.
And we have a product called the feather veneer, which is super, super, super thin. Now, a veneer is essentially something that sticks on the front of a tooth, right?
Yeah.
If you have something that's stuck to the front of the tooth that's really chunky and thick, because it has to be because of strength, let's say, this is what you're talking about, like tombstone veneers and old-fashioned stuff. You'd have to accommodate that by drilling the tooth down so that it doesn't end up being massive, right? Which is where it comes from. That's where you drill the teeth down. Things have moved so much now.
Because I saw a terrifying photograph of a celebrity, and my God, that's like a monster coming at you in the night.
And then they fall off more because of the fact that there's not much underneath. They don't stick very well. They look bad. You get this kind of step up at the gum line and all these things. It looks very artificial. So that is a problem because you don't have that tooth left anymore. You can't grow that back. And then what's your next option after that? You have to have a full crown, which goes around the whole tooth, drill more. And then what happens after that? You have to lose a tooth, and it's a cycle.
Next thing you'd be putting dentures in.
Yeah. So we don't want that cycle to start. We want to delay that for as long as possible. So now we have pressed ceramics, which are different material to traditional porcelain.
Okay.
And they are much, much stronger. So hugely strong. I should have brought one actually, but if I had one, I could drop it on the floor and it wouldn't smash. It would just be strong. So that means you can actually make veneers now that are 4 times less thick than the
Yeah.
original veneers. So we're talking about 0.1 millimeter I can get it to on like the top surface,
Oh my God, amazing.
down to 0.5 of a millimeter in the thickest bit if we have to. So it means you don't have to take away as much tooth, if any.
Yeah.
So if we're doing like 10 teeth and a full smile, I'll barely touch, if at all, the side teeth at
Because
like,
what
in
is the
any way.
danger of actually drilling down the actual tooth?
So yeah, some patients come in and like, I hate my teeth. I don't really care what you do to them. I just want them to look good. And I'm like, no, you should care about this. Let me explain why we don't want to do that. It's because the enamel is the strongest part of the tooth. That's the white bit that we all see.
Yeah.
On the inside of that, you've got something called dentine, which is like a sponge. So if you imagine you've got a hard surface over the sponge, when you bite, the sponge bends because it's like a yellow dish sponge. Imagine it's like that. And this is rigid. That enamel's your shock absorber. It absorbs the shock as you chew. It also protects the nerve, it keeps the tooth dry and all that sort of stuff. So it's healthy. If you lose that enamel by drilling it off because of a cosmetic thing and you're putting something really chunky on the tooth, you are sticking your thick, strong veneer to a sponge.
Yeah.
This time it doesn't absorb the shock. It just crashes, and they either fall off or you get breakages and that kind of thing. And then you lose more integrity of the tooth, so you get closer to the nerve, get more nerve problems. It's like makes you wince, right? The thought of it.
Yeah, no, don't.
Yeah. So that's why we basically over the last, it's like 14 years I've been obsessed. How do we make these thinner? How do we make them look more natural?
And natural, because I think that's the problem is it's very, not rare because you probably wouldn't know, but it's very obvious when someone has had their sort of, I'm going to call them turkey teeth.
Yeah. And if you think about the history of where did veneers and cosmetic dentistry even come from? It started in Hollywood. Right?
Yeah, the old Hollywood smile.
Yeah, exactly. And a Hollywood smile essentially exists to take away all of your imperfections and put something that's perfect. So imagine you take your mouth out of your face, make them look all like with a ruler and put them in. That was a status symbol.
Yeah.
The rich people in Hollywood were able to afford that, and people were like, wow, you can do that. That then totally changed as dentistry became more accessible. And so now the trend, as we're talking about, going from that look of done, people are dissolving their fillers, they're having less Botox,
I know,
all this sort of stuff.
we just had a surgeon, we were talking about that as well, that actually the more natural looks coming back.
It's so super elegant. And obviously everyone's obsessed with Kris Jenner's facelift right now, right?
Phenomenal.
I can't stop looking at it.
Yeah.
And the thing that everyone's loving about it is just how natural she looks.
Yeah.
She doesn't
I'm
look
quite
done.
relieved, if I'm totally honest, because I think there was a point, everyone firstly was beginning to look very similar.
Yeah.
Whereas now we're going slightly back to looking more unique.
Pumped up lips.
Yeah.
All that stuff. So it's actually really difficult to create a result that looks much more natural. You have to understand a lot more about the features of the face and harmony.
Because also, if you've got a small face, like I have quite a small face, if I got those fuckers strapped on, crumbs, I'd look a bit ridiculous.
And it's going the other way. Like our patients who come in, they're quite discerning. They know what they want it to look natural. They don't want to walk into like a boardroom and then be taken like a joke.
Else. Yeah.
Right.
It's like that episode of Friends, Ross Gannon is just his teeth.
Exactly. So the elegance that your smile provides is actually going to unlock so much more confidence, but only if it's done the right way.
Yeah.
And sadly, about 30% of my work is redoing existing stuff, not just done abroad, but actually done in London, even down the road from where I am.
Because I was just asking about this. Regulations on dentist work, like how does that work?
We're like massively regulated.
Is it more so than sort of surgery stuff?
I would say it's the same, if not more.
Really?
Yeah. Yeah, it's huge. So, but I think let's say you come in, right? You want to have a smile improvement. You have the impression that it's going to look really natural, and then it doesn't. Then you're going to have it redone. And my thing is, how do we explain to people that just get it done right the first time, Because if you do it the second time around, of course, like we can do it. It's not an issue. But you're having to redo the treatment. And so it's a bit of a shame, firstly. There's probably costs involved, but it's your natural tooth, and we just need to protect that for as long as possible.
Do you think a lot of people don't appreciate what they're actually going to look like once they've had it done? Is that what the issue is?
I think that's one massive issue, because traditionally in this way of dentistry, what's done is you go in, you say, okay, this is what I'm looking for.
Yeah.
You agree it. Then the dentist will send to the dental technician who actually makes the veneers in the laboratory, this is what we want. They will understand. It's like, whispers, like I tell you what you want, then they tell technician. By the time it comes back, it's like nothing like what you thought in your head.
Yeah.
So that's a big problem. So we did fix that using something called a handmade trial smile. We call it smile sculpting.
Okay.
So what that is if you come in with your natural teeth, we kind of have a facially driven assessment first, And then we would say, okay, this is what we're looking for. These are the issues with the face and the smile. This is what we want. We agree that. Then we'll hand create each individual tooth to look like the final tooth with you in your mouth, not externally.
Yeah.
Because that's when you end up with something that's wrong. So then you leave with that. And a week later, you come back, or a day later if you're coming from a distance, and we review it. Because you need to get used to this. It's such an emotional thing.
Yeah.
You need to get used to the change. And people who change a lot about themselves.
Actually, your teeth massively change the whole way you look.
Yeah, exactly. And we understand that. So if you're having it done quickly and with no ability to test it out, then it's like, it's guesswork. It's not the kind of thing you want to mess with. So you're able to experience it in your own life, at work, like do your podcast, like do whatever you're doing.
Well, can I tell you something? From this podcast, I've noticed I've got a fucking wonky smile. Why is that?
Well, it could be that, it could be that the teeth are creating that, because a lot of the time what I will do is I'll marry up the edges of the top teeth with someone's asymmetrical lip. And what that will do, and I can give you a photograph so you can see this, is it will make the the face look like it's actually symmetrical, even when it's not. So let's say this lip comes down on this side.
Because half mine goes up, the other goes down.
Yeah, so then those teeth where the lip goes down need to be lengthened more than the other side.
Interesting.
And then it flows.
Oh, I thought it was to do with where I pushed my filler around from smoking. Probably not then.
Maybe.
Oh, that could also be a problem.
So, we do want to sometimes dissolve stuff and balance it, but essentially it's muscle pull.
Right.
Muscle will, and if you have filler, it will just sometimes, depending on how it's done, exaggerate the muscle pull.
On that, why is it that a lot of dentists now also offer cosmetic surgery?
So stuff like Botox.
As in, because a lot of cosmetics. Are they called cosmetic doctors?
Yeah.
Go from being dentists to price. Is it you make more money?
No, not at all. Actually, it's to do with the fact that we do deal with the face, so we learn a lot more about head and neck anatomy than any other profession. So we spend years learning about the anatomy from here upwards. So every vessel, every muscle, everything, nerve, we learn a lot about that.
Yeah.
So it means we're safer, essentially, if we're doing Botox and stuff
interesting.
like that.
I thought it was just the old paycheck.
No.
Okay, that's
I would say
makes
it's really,
sense.
really hard because you've got to see a lot of people, I guess.
Yeah.
But that's one thing. Also, we deal with injections, right? Which I know no one wants to think about.
No, listen, I don't mind the numbing. It was when I had the milkshake, it ended up on my knees. I thought, hang on a minute.
But we're pretty good at a steady hand
and
injecting into really small, precise places. So it kind of lends itself
Makes
to
sense.
it. And then the other thing is, a lot of dentists are actually really aesthetically minded. We're not working on an area that's not visible, like inside the body or something. We're working on the most visible part of your face. So you tend to have an interest in making people look good and feel good.
Do you find now when you look at people, you slightly analyse the way they look?
No, because I think...
Oh, I thought you were looking at me funnily, and I was like, tell me what you're thinking.
I was looking for that migrating filler.
No. Dare you?
No, I think I'm personally pretty good at just switching it off.
Yeah.
What I can't help but see is notice people's teeth, right? And just in my head, I'm like, what would I do? I could make it look like this, and maybe they don't know it could look like that. And that is part of it. I would love everybody to know that actually there's nothing to be afraid of with cosmetic dentistry.
Yeah.
Because that's a big thing. There's a fear factor of what will I look like? Will I look too different? What they can do to my teeth?
You undo it to an extent.
To an extent. I think this is where you mentioned composite bonding before. People will be guided possibly towards composite bonding because they feel that it's more reversible.
Right.
Because it's kind of just added on.
This is what I'm having done after Invisalign, so tell me more.
Okay. And there's nothing wrong with it. In the right hands and done well, it's good. Now, there's two different types of composite bonding generally. One is edge bonding, where you just add it to the edges.
Yeah.
And one is a composite veneer, which goes over the whole surface.
Okay.
I personally am not a huge fan of composite veneers.
Yeah.
Because of the fact that the material is porous, so it picks up stain. You have to add a little bit more of it if you want to make it look quite good, because it can be patchy once if you stop brushing, it wears away a bit. And I've seen that 6 months later on someone, and it's sort of just you can see the inside of the tooth and it just looks bad.
Jesus.
So you need to put a little bit of it on there so it actually works. And that might work for someone's face and might not, because someone doesn't need bigger teeth. That's not going to be right. And then the other thing is longevity. It will chip a bit more and those kind of things. If we have staining, so if we're smoking, if we're drinking coffees...
Never done that.
red wine, then it's possibly a material that, you know, is going to need to be replaced a bit sooner. Now, this is the important bit. when you replace anything on a tooth, you're drilling it off. So nothing is truly irreversible, truly irreversible, right? You can remove it really, really safely. So it's about who you see at that stage. And then if you replace it with something, let's say ceramic veneer, we don't expect people to want to reverse that because they're going to love it and they're just going to want that smile. And then in 10, 20 years time, they might have to replace one or two or the whole lot. That will leave them with enough tooth to work with underneath because we've done it ethically rather than drilling it all the way down. So my message really to people would be, don't be afraid of doing something because it's slightly irreversible. Just make sure it's done the nicest, healthiest, most beautiful way, least invasive.
Because I don't think people really think about the health benefit or the health side of it. It's very much the way it's looking.
There is a huge benefit to, firstly, thinking about mental health. And this is something that people don't really think about. If your teeth are getting you down that much, but you're afraid of it because of the things we've already talked about, then, get some help and see what you can do about it, because we see people just transforming themselves within 6 months after they come back and they have a review later. They're like so different happy. People. I know. They're wearing different clothes. It's like makeup, hair, like it's all different.
And I think also in a society now where it's very about the way you look. I mean, people are a lot more conscious about certain things. If it does make you happier.
There is that. And then there's a lot of people, a lot of my patients come in and say, do you know, I'm not being supported in this decision by my partner, or my sister says I shouldn't do it, or my mum, or whatever it is, because they think I'm fine, because those relatives are looking out for them, saying, please don't do something that you might regret. Right, which is good. But no one truly knows what that person's going through in terms of how they feel. And years ago, a patient said to me, do you know, no one supports me on this, but I hate my teeth. And she was valid, like there was a lot to do. And she said, I'm with my daughter, she's 5 years old, she's playing, we're having, let's say it's her birthday, cameras come out, I'm having a joyous moment, and immediately in that moment it's sucked out, because as soon as the cameras come out, I'm reminded I have to smile.
Oh my God, yeah.
And it's like, because you feel that, right? It's like, it's
and actually
so
your smile
sad.
Is your biggest sort of thing almost, isn't it?
It's so sad. So, and then we obviously did it, and she was like, this has changed my life. And all those people that were saying, don't do it, really quickly changed their mind. And actually her husband came in anyway after 6 months.
Really?
So the value in that is huge. But the actual physical health aspect, if it's done well, then you'll fix a bite. That's something we always want to do.
I'll be honest, I didn't even think about any of this stuff. I didn't get Invisalign, because I didn't even think I needed it. I went in about I was a savage who had her tongue pierced when I was younger. Anyway, did I chip something? I chomped back on a Big Mac and half my fucking tooth came out in Australia. I went, and the
Which
tooth
one?
came
Front
out.
One?
I don't know what it was. It was back there. It was awful. Obviously, the piercing came out. Well, the piercing came out because my dad said, Olivia, only girls who give blowjobs have those. I said, but Daddy, you'd see me on a Saturday. No, I'm joking. Lies. And then, so anyway, I then did a lot of damage with the tongue piercing. But then I didn't realise my bite, and also they were slightly crooked at the front. But
the bite benefit is massive.
But why though? What's the...
If you think about, like, long term, what happens with our teeth, we get flattened teeth because they wear down. We get more uneven edges. The body actually strengthens the teeth as time goes on, naturally. So because it's protecting you from being able to chew food. And we know when people stop taking food when they're ill or whatever, that's the beginning of the end, right?
Yeah.
So the teeth become more opaque, they become stronger, they basically get worn down so you can still chew your food. Now, that process makes the teeth look less aesthetic as a result.
Yeah.
So often people come in because of this natural change that's occurring, but it doesn't look good anymore. And so part of our assessment would be, how did your teeth end up like this? Why is it that you've ground them down like this? Is it to do with habit? Certain drugs cause people to kind of grind their teeth and stuff like that. And often it's because their teeth are just not quite in the right place positionally. So it could be they've had Invisalign and they've finished them in a position that isn't quite right, which we see all the time. After Invisalign, we see loads of people with bite problems. And it's because they've been finished and all their teeth have been kind of brought in and tight.
Yeah.
And they start chewing and then their teeth start wearing down at the front. Then their bonding starts chipping and all this starts. So when we do our treatments, we're always trying to fix the bite. That's the number one thing. The other thing is you're protecting the surface. So if someone's got gum recession or there's a filling, you're sealing it all up.
Yeah.
So essentially you're really protecting that tooth from further issues.
Got
So
you.
there are benefits
Okay.
in certain situations.
Yeah. What is the worst thing you can do for your teeth?
I honestly think it's getting on a plane, going to a country where they do something super.
Let's shame that
quick.
country, Turkey. Why
It's the
is
most
it
common.
It's because it's the cheapest.
It's the most common one, yeah.
Is it just, across the board, it is always Turkey. Do we know any other places that you can go and get some dodgy teeth done? No, but
I think they're the best. I think they've really marketed to the UK market really well.
Yeah.
You see on the tube, like you see those adverts
Yeah.
for the thing. You see it everywhere, and they tapped into the whole influencer market and everything as well really well. So
the power
you know,
of influencers, by the way, I
Yeah.
think there's some shady shit out there.
yeah, and I don't know if you can trust everything that's put out, but the reality is that is the worst thing one can do, and the people that are going there, unfortunately, are young.
This is what that's what's scary though.
And I remember a patient of mine. We do virtual consultations. We begin with that so that we can reach anyone, right?
Yeah.
And people travel from a long distance, so that's not always possible to come in. So if they do a virtual consultation, I remember doing one for a girl who worked on a yacht, and so she was in different countries at different times. They happened to be in Turkey at that time, and I remember my patient care coordinator running out, being like, "This poor girl is like going to go and do this treatment." Someone said something to her, and she's like having a bit of like a panic before she goes in. Can you please speak to her? I was like, whatever you do, we'll talk later, but whatever you do, just do not walk in there.
Go in there.
And the plan was multiple crowns on her teeth.
Why do they say that you need this stuff if you don't actually need it? It's just money.
And they plan, yeah. And they plan it from an email. Everyone gets the same plan. It's like, and you can choose 3 different materials, and it's all just like the same.
But also, I'm not being funny. As a buyer, I wouldn't have a fucking clue what material
Of
I was
course you
buying.
wouldn't. You would just look at, what's the best? And then what you might look at is, I'm getting 24 teeth for the price of what Sam's charging for like 3. You know? So it seems like good value. It's literally the worst value you could ever have.
What is it about teeth that is so expensive?
So, yeah, I don't know how they do it so cheap, firstly. That's like...
Can you buy, I mean, you know how you can buy like fake filler for your face? Can one buy fake dodgy materials as teeth?
Yes. So it's no different to any other industry. We could use super cheap materials. We could order them on Amazon and bring them
I don't
in
like this
and
ordering
do
of things
stuff.
on Amazon all the time. It's very concerning. I mean, I order a lot on Amazon, not fake teeth, obviously, but...
So we have to use the top end materials, right?
Yeah.
It's thousands and thousands of pounds per month that would cost. If we don't, then the result will be bad. Like it won't fit properly, and we'll, you'll just have a problem. That's the first thing. Then technique, like we go through obviously a lot of study. Like after graduating, it's been years and thousands, hundreds of thousands of pounds for me. Like travel the world and actually learn from people.
What's the course, sorry, to be a dentist? What's your...
5 years minimum.
5 years,
Yeah.
okay.
So it costs a lot to do the training.
Yeah.
And then the other thing is the material. So this is what confuses me about how they get it done so cheap. I think it's maybe the cost of labour and materials are really low, but they're managing to give people 24 crowns, which, by the way, very rarely will someone need that.
Yeah.
For 3 to 5 grand or something. It's just I don't.
What would
understand.
that cost in the UK if you were to
If
someone
I had
actually
to
needed
do-
that?
Yeah, if someone had to do that, which we call a full mouth rehab, which we do quite regularly, that would be in the region of anywhere from 30 to 60k.
Oh my god!
So if
people do
someone
it for
in
my
there
God.
is 24 years old, didn't need it, could have had maybe 4 feather veneers, 6 feather veneers, or maybe Invisalign bonding, something like that, that would have cost them the same amount. They're then having to fix all of that, but now they're looking at like upwards of 40 to 60 grand bill.
Yeah.
How are they going to afford it? They can't
it?
afford it, so they live with it. They live with the pain because they don't do the bite properly. They just put them in and then just go off, right? And we're not. Obviously, there's a generalization. We're talking about these bad places, right? There's an amazing dentist in Turkey who I've actually learned from, but they're more expensive than I am. They're not the people that they're going to see.
But it's pretty bad though now because the whole turkey teeth thing has given such a bad reputation. I wonder how it's affecting their work because surely if people
Think it's declining.
Yeah.
I don't know. I mean, I don't. So the way I see it is, I feel bad for the people that go not knowing what they're expecting.
How often have you had patients come in saying, I have actually been to Turkey?
Loads.
Really?
Loads. In a month, probably 3 or 4 contact. Of the number that contact versus actually come in and we actually fix, much lower.
Because they can't afford it. That's really sad. And but with when you get that kind of thing done, what sort of like issues could there potentially come with that?
Things I've seen, most common, is badly fitting. So they don't fit against the teeth really well. So there's
It's like
gaps.
sticking an acrylic nail on, but in your mouth.
Yeah, and you know when you fit it on, you have to keep it super dry. There's like it takes half an hour to like clean the one veneer before we put them on someone's tooth. I don't. If that's not happening, it means that it's going to just get stuff underneath it. So they if it's done badly, then what I see is gaps that causes gum inflammation. I see like staining. The other thing is, sometimes I've seen really tight, like there's no space to clean in between, so then the gum gets worse. So that causes a discomfort.
Making me feel funny, actually.
I know, it's unsensitive. And then the one thing I see all the time is bite is wrong. Because if you're doing 24 crowns, you have no teeth left, right? You have like a stump on 24 teeth. So they create these digitally printed. We don't do anything digital. We create everything by hand. Each tooth will take us about 8.5 hours to make.
Really?
But that's artistry. That takes ages. And you're working with 0.5
Sort of the point of getting
millimeter.
into it, really, almost, isn't it? It's that side of it.
They're working on digital printing. It's like done in a day, and you go and you're on the beach, you go back the next day and fit them
Oh,
on.
my God. I need to go visit one of these clinics.
rushed.
I'm just fascinated.
That would be, as a potential patient.
Yeah,
right? Go and
but
see
what do you think they've got a conscience? I just wonder something. They
This
don't.
is what annoys me the most, is that it's some. I hear a lot of people like blaming the patients for going out there, and I think if you know what you're doing, then maybe you deserve that. But if you don't, then it's a shame, and that's why for us it's getting the message out there, right?
Because I think that's the problem, is a lot of people aren't really aware of what they're actually, the negatives they should be looking out
sad.
for.
Research is probably the most important thing. And then the second thing is, that thing that annoys me the most is these are people that are like professionals, fellow professionals doing it. How can you live with yourself?
Yeah, but that's what I mean. I don't know how people sleep at night knowing they've done something dodgy.
But I did hear something really dodgy. That was that this person went to some clinic, and it wasn't even a dentist. It was the dental technician who makes the teeth. The dentist wasn't actually even there. Drilled everything, and then the technician made it, and then just fitted it. Now, you don't know if all these things are legit.
True,
I
but
also
no,
heard about someone going for... Did you hear about the one where someone went for a boob job and
came out without a kidney?
Without a kidney, yeah.
I did just ask the surgeon. He said that's not true.
Is it not true?
Well, I heard it from someone who said it was one of their mates. But now that I've heard everyone knows the story, it can't, unless it is commonplace.
So you don't know, right, if these things are.
Yeah.
But that's what I heard someone told me about, that it wasn't even a dentist. So there's no regulation, right? You don't know who it is. You can look me up and find everything if you want.
Yeah.
But there's nothing like that there, so...
It is mental. And quick question, because obviously now people don't get gold and silver teeth. Do you have people come in where you're removing those teeth?
Yeah. So often we'll have someone with a gold crown, because it was something... This is what I mean about trends, right? That would have been trendy.
It was a trend?
It would have been a trend, in certain people would have done that as a I can afford a gold tooth, right? So it's like a status thing.
Imagine me with a gold tooth. Grills, is that what they're called?
And there was that whole thing about putting diamonds on your teeth.
Yeah, what was that called? Yeah, the people still do that.
Yeah, people do that. A friend of mine had it done in India when she went to have something else done, root canal or something. And dentist
got diamonds slapped on there. It's like a vajazzle for the mouth.
Okay, it'll last 3 months. And then we were sitting there at dinner like 5 years later. I was like,
you've got a bit of shit on your teeth. I'd be too nervous that it looked like I've got something in my mouth.
I mean, that's a bit of fun, I guess. It's not really going to do any harm. But yeah, these are just little trends, which are fine. But the trend of like going and doing something irreversible like that is just awful.
It's too risky. Okay, talk me through real health and hygiene of the mouth, because some people I don't think are familiar with it. And I appreciated the days where certain people wore masks during COVID.
You sound like you're speaking about specific people.
Well, you listen, there's nothing worse than being smacked in the face by someone with halitosis, is there?
Yeah.
But is that people with bad breath generally, is that actually a medical, some people obviously aren't hygienic, but is it what medical condition can cause bad breath?
Two main things. We want to rule out anything in the mouth first.
Yeah,
okay?
so what could it be?
Gum health. If your gums are bad, generally as dentists and as dental hygiene therapists, we can smell gum disease before you're in the chair.
Imagine walking out, I can smell you've got gum disease, that's
and we do, like if I'm somewhere, like I was at a restaurant the other day and I was like, the waiters like needs some help.
Did you tell him?
No, because it's awkward, isn't it?
No, but I think now, because of your profession, I think we should start changing the way.
Yeah,
it's a polite thing to do. Listen,
it's
sweetheart, your breath's quite bad and you're serving me something, but
it's helpful, isn't it?
It is.
But it's
constructive.
You don't want to be that person. So I think things might change over society, but I would don't know about that. But anyway, I can smell. I was like, "There's gum disease here." Like, seriously, I would love you to come in.
Present.
But that's number one. The second is if you had kind of a bit of bad dentistry, or the dentistry is really old and done a long time ago, it's not fitting so well. You get food stuck in between teeth and stuff that doesn't smell so good. And then things like your oral microbiome. So there's a whole thing about the balance in your mouth. So how acidic things are in your kind of your physical state. So that can give you bad breath. And then if it's not teeth or mouth, then also dry mouth can do it as well.
What's dry mouth?
It's just like if your mouth is just dry.
Just dry.
So either through medications or just you have a condition that causes dry mouth, or like not being hydrated enough, stuff like that.
After a heavy night, I'm sure people have
like exactly. So like stuff like that, or mouth breathing overnight, things like that doesn't help.
Breathing.
So you don't breathe through your nose. It's like, breathe through your mouth all night. And that can dry it out. So there's these things. But then if you deal with all of that and it's none of that, then it's likely to be a stomach bacteria.
Oh gosh.
Which it's a reflux, or there's some bacteria in there which is coming through. So it's not a simple one. I start with oral hygiene. So brush your teeth.
Yeah, twice a day.
If you can floss, then do that. And then there's all these things like the water flosser and all that stuff.
I've got one other question to ask you. Tongue scrapers.
Yeah, cool. Really good.
Really?
Yeah.
Niche. A guy I know decided to start a company with a tongue scraper.
Yeah.
Okay, interesting.
Yeah, it's cool. It's good. It's a very traditional, like Eastern thing.
Yeah.
So in India, they've been using tongue scrapers for years.
And what is the danger of those snus? Those funny snus?
Oh,
what's that doing to the gums?
Like the powder.
Yeah, those funny pouches. I watched my sweet brother put one in the other day. I didn't know what he was doing.
Anything that has a pH that is slightly acidic can cause damage to any part of the body.
Yeah, because like apple cider vinegar is a major one that people don't think about, do they?
Exactly. I had a patient the other day, and I spotted this. We were talking about improving her smile at the front. I looked on the inside, and there was all this acid wear.
Oh God.
So I said, "Are you?" Because I know she looks after herself, and I know she has a PT and all that sort of stuff. So I thought she's healthy. I said, "Are you necking like lemon and Himalayan salt or something in the morning?" She's like, "Yeah, how'd you know?" Your teeth had told me, because you're stripping the enamel. It's like paint stripper for your teeth.
Oh my God.
But it's the worst thing we can do is citrus, especially in a liquid form.
Better just sip it with a straw.
Straw will definitely help, but it still may not resolve like the tops of the lower teeth where it sits.
Yeah.
So it's not great. You probably want to dilute it and have a straw as well.
Okay, interesting. Fizzy drinks, obviously those aren't great.
Same issue. Acid. Anything that's acidic will eventually strip the enamel of the tooth.
And that's something you can't get back.
Well, then that's sometimes the reason why we do our treatment.
Yeah.
And build it up with the most minimally invasive way.
That was what I was going to ask. People, after I've had these Invisalign, will I have a retainer for the rest of my life for the evenings?
Well, yeah. So you asked me something earlier. I can't remember what it was. It was about what's the worst thing people can do.
Yeah.
My advice: the best thing people can do for their teeth, other than regular hygiene, etc., is wear retainers. Whether you've had Invisalign or braces or not, if you wear a retainer, you'll stop that age-related movement. We were talking about wisdom teeth and not being wisdom teeth, but just movement.
Yeah.
If you wear a retainer overnight, that will stop that movement.
And that instead of getting a wire put behind.
Well, a wire is just a different type of retainer. It's a fixed retainer. So I've got them upper and lower.
Yeah.
And then I have a removable retainer I wear overnight on top of that, because I just don't want any movement. So if there's one thing you can do, and to prevent changes in your teeth, other than hygiene and diet, it's wear a retainer.
Okay.
Because the retainer will stop your teeth moving, and if they move, you're more likely to chip dentistry, you're more likely to get tooth wear, other issues. Yeah. And so if you keep them where they are, nothing's going to get particularly worse, right? Which is, and also you get gum recession over time if teeth move around and stuff. So yeah.
If one's brushing their teeth and they're bleeding, and it's all your gums are bleeding, is that gum disease?
It's a start of gum disease.
Right.
And isn't it weird how we would never accept blood, on an unexpected place, in the body?
In your mouth, you're kind of just fine with it.
Yeah, a bit of blood is fine.
Because I saw a friend of mine posted something the other day, and she said it was potentially linked to post-pregnancy, post-baby. There's some connection.
There is a higher risk during pregnancy of gum disease than when you're not pregnant. And that's because of the reaction to plaque and anything in the mouth is exaggerated at that time.
Right.
So it's just more important to keep on top of the hygiene, basically.
With gum disease, what can you do to sort of Bring it back in.
Regular seeing the hygienist for cleaning.
Yeah.
So people ask, oh, why can't dentists do a quick clean? It's like, yeah, but that's not enough.
You need to go
You
and
need
get
to get
that.
deep cleaning done, disrupt the microbiome, disrupt the biofilm in the mouth where bacteria just let it sit in there and start to eat away at the bone and the gums. Every 6 months, that's minimum for most people. Some people need it a bit more regularly. And so that's the first thing. Then there's someone called a periodontist, which is a gum
Who the
specialist.
hell's she? Okay.
Which is where you end up if your gum disease gets to the point where actually you start to get looser teeth or losing the bone underneath the gum, because that's what ends up happening. So just maintenance, brushing, hygienist.
Yeah. Okay.
There's something that I see a lot, which is because my interest is in the bite and aesthetics and restorative, is heavy force on teeth. Let's say one tooth is taking more bite than another.
Yeah.
Generally, they will have more gum inflammation or looseness or bone loss.
It's just not
or
something you
something
think about, is it?
than
I
another.
understand your right hand's stronger than your left or whatever
Yeah.
it is, but you just, the
It
size
should
of your
be
mouth.
balanced, ideally. None of us really are. But
Yeah.
as close as we can get to balance is good.
It's interesting. Teeth whitening. Strips.
Oh, yeah.
Where do we start? Where do we finish with all this?
So another myth with teeth whitening
Yeah.
is it doesn't like take a layer off your teeth that people
It
sometimes
doesn't.
think. Yeah.
But what are the different versions? Because I'm meant to be getting mine slightly whitened. I don't.
Yeah.
I want the. That's that. Weirdly, the one thing I'm nervous of is the whitening, because I don't. I mean, I like the color of my jumper, but I don't think I want my teeth to look like that.
Yeah. And I think when you're whitening your natural teeth, you don't really need to worry about that.
Okay.
Because they'll just get to where your teeth get to. Everyone's got like a max.
But is it like you nip in, have it done, you come out again, or is it something you do?
You
over
can do
time?
it like that.
Because I tried it once, and it was I had the retainer things a while ago, injected some stuff into it. My gums went fucking purple. I woke up and I thought, what the hell's this? So I had to stop doing it. It was so painful.
You probably put quite a lot of gel in it then, maybe.
Probably I'm a bit, firm with my hand.
Yeah.
Not like that. Sorry.
So,
Grow up, Olivia. But yeah, fine. I was putting
Yeah.
too much in there.
Probably. Or the trays didn't fit properly.
Okay.
And it leaked out onto the gums. Teeth whitening is totally safe, okay?
Yeah.
As long as you're not using like banana skins and whatever acids and stuff to do it.
Yeah.
But you get properly fitted whitening trays made for your mouth from the dentist. We can take digital scans or impressions to do that. It's super simple. And then you get a safe whitening gel that you wear either in the day or overnight, and you do it yourself over a period of time. That will give, it was about 2 weeks, that will give you the best result for whitening. It will
Okay.
take your teeth to your natural white. It will never take you to what you're worried about.
The
which is
veneer white, yeah.
That's when someone has picked a
specific
veneer
tooth.
colour that's like
Okay,
way too
fine.
white. And you see that with certain celebrities. Like I can spot when someone's had dentistry done when their teeth are just too opaque in white
Yeah.
colour, or the tone is wrong. So what I'm always looking at when I'm picking the colour for our veneer treatment is the colour of your eye. The white of your eye is what I
Oh.
use to match the colour of my veneers.
God,
Because
when I was boozing heavy, mine were yellow.
yeah. So yeah, and then we have to kind of look past the temporary changes to see what a true colour is.
She's a booze hand. No, she.
But the
That's
reason,
so interesting, actually.
yeah, the reason for that is if you walk into a room and people don't know you, let's say, and they spot Liv's had her teeth done,
Yeah.
that is probably because the teeth are not in harmony with the complexion of your face.
Yeah.
So you don't want the two whitest parts of your face, which are your eye and your teeth, to be fighting against each other and one winning.
See, stuff like that, I've never heard that side of it. Like,
Yeah.
people would never explain it. It makes total sense.
If it's within harmony, and I don't mean it's like exactly the same color, but that I talk about it as tone.
Yeah.
Some people have warmer tone in their eye, and some people have colder tone. So if I was picking and layering this is why making it is such a big thing. You can't just make it and just fit it
Yeah.
on. You have to layer it differently in the ceramic. So we would pick colder tones in our lab versus warmer, depending on what someone needs. If I give someone who's got a white, cold eye, warmer teeth, even though it's the same shade, like could be the same coat, their teeth will always look yellow. And the other way around, if I make
That's
someone
actually
who's-
fascinating.
Yeah,
What would I be? What kind of tone am I offering?
the big night last night.
I haven't had a drink in 3 months.
No, you were on a colder tone,
Oh, cold eyes.
which is good, but you're not like strikingly cold. So I would go with a blend. I would make the base of my veneer in a colder tone, and I would layer it with warmer on the front to give you the blend.
This is very interesting. So everyone work out what your tones are, or ask for your tones.
What's your Pantone?
Charcoal, that's not a teeth thing, is
So
it?
okay, so all these these like dark toothpaste.
Yeah.
Think of it as if you put your sofas are like nice and white,
Oh,
right?
God.
If I pour something dark over it and then I wash it away, you're going to see a white thing. So your eye will immediately go from looking at something dark to looking at something white.
So it's trickery.
There's a bit of trickery in it.
That's so interesting.
Yeah.
God, but this is so crazy, isn't it? Because these things get so hyped up. Oh,
Yeah.
try my charcoal toothpaste.
I
It's
know,
a
and then
load
TikTok
of
and all that
rubbish.
stuff, it just like goes wild, which is fine. But I mean, that demonstrates what you were saying earlier about how how teeth are like a thing. So if something like that can go so viral, it just tells you how many people are
But
like,
it's
wanting to
scary
have white
because
teeth.
if you look at the average age of like a TikTok user, they're young.
Yeah, they're young. Yeah. And also it's like any home remedy is like catches on, doesn't it? So it's like, oh, I'll mix some bicarbonate soda with this and that and a bit of lemon peel.
Oh yeah, the one at the moment's the castor oil in the belly button. Is this a thing? Does this help with debloating? Don't look at me like that. I've seen it everywhere. Have you not seen it? People falling asleep with their stomach bands.
I mean, it's probably not going to do you any harm, is it? But
trying a bit of castor oil. You could also try my lube if you want, but not on your belly button. Anyway, moving on.
Okay, so whitening, how they're you said different ways of doing it. If you go in and you have a light put on your teeth, we now know part of that is also an illusion as well. So we got rid of our lights because I just don't think it's a real thing. The gels whiten the teeth, not by stripping enamel, but by pulling out stain from within the tooth, and that's safe. When you go in and have a light put on the tooth for a couple of hours or whatever, and you walk out with whiter teeth, part of that result is because your teeth have gone dry. So if you think of a stone like a rock on the river, when it's like a drought, that will look chalky and white. When there's water over it, it looks darker. When your teeth are hydrated with saliva and they're in your mouth, they will look darker than when they're dry. So part of it is dry. And we know because we did an experiment. I put 2 members of my team in one room with the light, with the gels and everything. And they both had the same starting shade. And I put 2 people with just, those rings you get from that game, like Speak Out, it's like that, just dry. They both were exactly the same after the 2 hours.
Really?
No different. So then what you would usually get with those lasers is you get whitening trays afterwards, which are the things that are actually whitening your teeth.
It's not the other stuff. Okay, got you.
So we binned the lights and we still get phone calls, like even on a daily basis, 2 or 3, do you do in-house whitening? And we're trying to explain to people that actually it's just not.
That's what I meant about that. Okay, that's so interesting.
Yeah.
Do you find it slightly disheartening, not disheartening, but annoying when you hear of other dentists doing certain things like that purely just to make money? When you're like, from your perspective, it's more like artistry and genuinely wanting to help people. Obviously, the paycheck's probably great, but
I mean, I tend to personally just stay in our lane, right?
Yeah.
I try and my personality is I just don't really want to be distracted by what other people are doing. So if I'm focusing on improving where we are, then we'll just get better and better and better all the time.
Oh, that's such a nice positive thing. I'm such a bitch. I just think, you know what, you should fail.
And I have an academy where we train dentists on how to do our type of treatment, like the facially driven design, the feather veneers, the handmade trial smile, like get all this stuff done. Because I want that to be the norm. I don't want to see heavy preparations, ugly teeth, artificial stuff, people being left with problems. I don't want to see that. So that's what annoys me.
Yeah.
What annoys me is when I see people who have come to see me afterwards and they've seen someone who claims to have an amazing reputation down the road in London or wherever else in a really high-end clinic, and the work is not what I would consider to be the most aesthetic or most functional.
But do you think what's happened is some influencer's probably gone there or done a job with them, promoted them, and then everyone's going, oh my God, they're amazing, I should go?
Yes, and I think that's one aspect. Some to do with marketing, right? Like however people are marketing themselves. I also think there's a lot of people that have been doing this for quite some time, and we all need to continue to innovate. Like maybe there'll be one day where I go stale, right?
Yeah.
And someone else comes up with something that's going to make me look like old-fashioned. But there's still that happening.
But do you keep up with, like, do you do certain courses now that sort of keep up to date with the different trends and all that stuff?
Yeah, we just now, because we have our own lab and we're teaching, we have to be pushing stuff all the time. So we have like 10 different materials, which sometimes for a patient, and they don't always know, we will make 3 sets of veneers.
Just sound like a bloody good dentist.
Just for our own, not for them, because we know which one's right for them.
Yeah.
But it's a good opportunity for me to test different things. And I'll try them in and stuff, and then they'll have the one that's the right one for them, which we always knew anyway.
Yeah.
But if we're ordering a new material, I don't want any real patient to be a test bunny. Like, I'd rather do that. So because of that, we're having to innovate all the time. I want to be ahead of the game. I don't want to get stale.
No, I think that's good. Do you think influencers have changed the way a lot of people view their own teeth?
Yeah.
Because it's gone from the Hollywood thing to now actually it's influencers, isn't it? The gap in the teeth. But who is it? Dakota
Amy Lee
Johnson.
Wood.
Yeah, Amy Lee Wood. Yeah, is she keeping it? That's a natural. That's just a
I
natural.
think she said on, I don't know what it was, like Jimmy Kimmel or something.
Yeah.
Like, everyone talks about my teeth, and I just like love it.
Because I think Dakota Johnson had one, but she didn't realise, but it sort of closed up, but she didn't intentionally mean it to.
If you're thinking about what a trend that in dentistry that exists at the moment, cosmetic dentistry, I think it is bringing back natural, and it's not doing nothing. I definitely don't, because people are doing things more than they ever have.
Yeah.
But it's moving away from the massive teeth that like don't fit in your mouth, that are all the same and white and blocky and all this sort of stuff. So having the right tone for you, looking natural, translucencies, textures, and keeping people guessing.
Yeah.
It's like, haven't they? She's got really nice one, but actually, and then they're like, that is what people want.
Yeah.
Rather than, and that's what I see. I'm sure there are still, and geographically it's different, right?
Yeah.
Depending on where you are, there'll be regional stuff as well. That people, I'm sure there's a group of people that still want that. But generally, I feel the overarching thing in all of cosmetics is natural.
natural.
And natural doesn't mean crooked, like yellow, like brown.
It's very distracting, isn't it? I hate to say it, and actually, I always am surprised when I've met certain people who spend a fortune on everything minus their teeth, and I just think that should be your first sort of thing to go for.
I agree,
because it's a lot, isn't it?
But you see, that's what we understand is this fear associated with that.
I don't mind the dentist. I don't mind a good old poke.
And it's probably because of it's not maybe even the it's probably not even the fact that they're scared of the dentistry, the treatment. It's they're scared about looking too different, and this is the number one thing
that's holding people back.
We do really well,
but is it
not do that?
The kind of thing a bit like lip filler, you could do baby steps, little small bits here and there, or you kind of got to just get it done. Really,
I think it's finding the right person that can see the vision that you have and being able to execute it, because that's what I think holds those people back, is they don't want to look like they've had veneers and things like that, which is totally valid, and they shouldn't want to look like that. But that's what holds them back, and they think, I don't want to look fake, I don't want fake teeth. And they'll do everything else. Yeah. But then they're just so afraid of it. And that's why we want to talk about facially driving the design like so much, because that's the bit that can save the people from having to accept what they've got.
It's so true, actually, because it's also one thing showing just what your teeth are going to look like, but the teeth attached to your face. Yeah. What happened to Happy Gas?
Oh, yeah.
I was partial to that as a kid.
Yeah, we're not allowed to use it.
Probably why I'm a bit funny now.
Yeah.
Did they?
We in the US, they're allowed to use it, like, freely in practice. Yeah, we're not allowed to. And also, you were allowed to do, you have to be in a specialist place for it. And also you were allowed to do general anaesthetic. I remember when I was about 9, I had 4 baby teeth that weren't coming out removed, as well as 4 adult teeth, all in one go. And I remember it. I remember waking up from general anaesthetic in my local dentist.
Oh my God.
Because
I didn't realise people actually have a general anaesthetic to get their wisdom teeth out. Absolute pussies. Yeah. I lay there, I was awake. Come on, doctor, dentist even, get those out.
Yeah, and I think, if you look at the recovery times for people that have treatments under general anaesthetic versus the ones that have
a lot longer.
Yeah, general
anaesthetic.
Why
is that?
I wonder whether it's because when someone is awake, we have to take a lot of care because we're not trying to. Yeah. Whereas it's
when they're asleep, just yank and pull.
Quickly do. Maybe, I don't know. I don't do it, so I don't want to
I had to roll up to filming.
Surgeons, but
having had 2 wisdom teeth out, let me tell you, I look like a fucking beaver. Filming made in Chelsea, and I had the whole day an ice pack strapped around here, and they were like, right, get that off. It was awful. I looked like I'd inhaled the snack box and can really speak. Obviously, that whole thing about, what is it, dry socket? Didn't worry about that. I was smoking away.
Yeah, smoking will do that.
Yeah, really bad.
As we get older, we show more of our lower teeth when we're talking.
Yeah, my sister told me this the other day. I didn't appreciate that. I'm a young 30-year-old.
No, I know, but that isn't why yours is there. Some of us, just like myself, I'm showing my lower teeth a lot more, right, when I'm talking. Which means that we're just, screwed in like 15 years' time. Because this is all going to come down, and we're going to show a lot of that, and we're going to look older. So
I'll have the downward smile.
So we're going to have to do something about it. I get asked to add, to make the smile look more visible by so many patients, because they've lost volume in their face over time.
How do we do it?
By actually making the teeth thicker, bigger. Okay, and then we control the size by translucency, texture, reflection. I'll show you an example. So if you look at this one, right? Have a look at that. She's not got bad teeth at all at the above.
No.
But she's showing more now. We've finished.
Yeah.
Okay. And that I've got more examples that are more severe than that, way more severe. But the issue is of volume. Your upper lip is asking for more volume. It's something called lip support. If the upper teeth are, and it's not length actually, it's volume. Because you can't just make someone's teeth just as long as you want.
Right? Oh, so mine should get fatter, not thinner.
You should have volume added to them. And when you have volume added, it doesn't mean they end up big if it's done well.
Yeah.
It means your lip has something to rest on.
Yeah, because
rather
I've
than
noticed
falling.
now with my Invisalign, people think I've had a bit of dodgy work in my mouth, but it's not. It's literally just because I've got a retainer in.
Yeah, and that's adding a little bit of volume. So
And I
you'll be
quite like
showing a little bit more of your upper teeth when you're talking now
Yeah.
than you would be without the Invisalign, just a bit, because that Invisalign's super thin.
Yeah.
But imagine you added even a double layer of Invisalign, just slightly more. As you talk, you will show more of your upper teeth, and lip support is the #1 way of making someone
That
look
makes
younger.
much more sense. Okay, interesting.
We can take decades off someone's face purely by giving them the right amount of volume, which means you need something added to the surface of the tooth,
Yeah.
which means you need a veneer of some kind.
Okay.
Not to be confused with what we just discussed,
Yeah.
right? Rather than edge bonding, which is at the bottom of the tooth, which lengthens,
Okay, so
but doesn't
that's-
add volume.
See, I think that's okay. We'll cut all this stuff, but I think that's what she said to me is to lengthen them. But I think I'd rather that.
Yeah, because what you need is you need width at the side, and then you need a little bit of visibility here.
Yeah.
And that also future-proofs us, right? And then in 20 years' time, or whenever it is, then you'll lose a little bit of volume and you can do it again.
So that overall could generally make your mouth slightly bigger.
Yeah, and people are worried about this because they think, I don't want big teeth, I don't want big teeth. But that's where you have to trust the dentist and the materials.
Yeah.
Because if we don't give you opaque, we don't give you like Tip-X color, all that stuff, we know how to make the angles look good. Your teeth will actually can look like the right size. Have a look at this one. Look at that before and after. So she had composite bonding done
Yeah.
on the top.
Yeah.
You see how bulky and big they look?
They looked, yeah.
And now she was like, I don't want to lose my big teeth. I've always had big teeth, but they
It's
look
almost like
bulky.
they're thinner on they go thick to slightly thinner.
Yeah, and that
That's how I
is all
also get
to
my
do
nails
with-
done, if I'm honest.
Yeah, that's to do with adding the right amount of volume.
Yeah.
and having the right materials. That is over 50s female. Then mostly it's I want my smile back. It's gone. And sometimes I used to get complimented on my smile. No one says that anymore. And when I stretch my face to smile, I can't see my teeth.
Oh my God.
And that's
Yeah.
the motivation. So yeah, volume.
Okay, volume. The one that's got me is the color of the whites of your eyes and your teeth. That's such an interesting
know.
thing. But it's so
You
mad.
know, when I figured that out, I was like, wow.
That's what it
is.
it makes so much sense. But actually, I suppose it's like people who get your hair the right color to your skin tone,
Have you those people who are color
matching your clothes?
Yeah.
I actually had that done once, and the colors I came away with were very not my sort of thing. It was like burgundy.
Yeah,
And I was
they say
like-
burgundy works well with like brown skin.
Really?
As well. So
And like orangey. And
I realised that light blue, like I've got this light blue top, and it just looks really bad. So I think maybe it's
it's interesting.
changed over the years.
Holy shitballs. I can see, yeah.
Okay.
Crumbs.
So a lot less. But
Yeah.
let me show you another
You
one. So
brought that down?
Yeah. So this one was a gum lift. Okay. Now there's two ways of doing a gum lift. I have a laser, which is like a little pen
Mm.
that shapes a gum, and I can lift it, but very slightly. So if we need a little bit of it done,
Yeah.
then we'll do it like that. Like for example, let me show you. You know, we're talking about facial asymmetry, like your lip.
Yeah.
Look at this one.
Yeah, that's what's happened to my face. Like half of it's had a stroke. Just the
You
mouth.
see, nothing's been done to her lips. We've not done anything to her lips. At
Yeah.
all. It's just her teeth. This side has got longer.
That
and
makes
I brought
so much
this side up with the laser. So
Yeah.
it balanced it.
clever.
So the face looks symmetrical now.
That's what okay, right.
So-
After we finish this, I'd like you to have a good look.
Yeah. So what were we talking about? Oh yeah, gummy smile. Yeah. So that's one way, a gum lift.
Yeah.
The other way is having a surgeon. So the periodontist I mentioned can do cosmetic surgery to actually take the gum up, which is if you need a lot of it done.
Yeah.
Like the first one. And then the third way is lip flip and Botox.
Lip
which
flip
is this example.
is you just inject it in your like Cupid's bow bit. And what, it just sort of pulls it back a little bit.
Yeah, so you see, I see people having the wrong lip Botox done as well
Yeah.
sometimes. So if you have a gummy smile, like this lady has trained herself to keep her smile on that level. It's
Yeah.
not that gummy. But if you look at the after,
Yeah.
it's a lot more level
Got you.
and it's lower. That's just with Botox and the veneers on the top teeth. But If she just had gummy smile Botox, and this is where when you see a good this is why dentists would make really good.
Yeah. So wait,
Botox
do you
people.
do Botox?
We have it at our clinic. I
Yeah.
don't do it myself. We work. One of my clinicians does. Yeah.
Yeah.
So if this case, I sent to her for that bit during our smile sculpting trial smile bit is when we send the patient there, so we can make sure that looks good with the lip.
Yeah.
If she'd just done gummy smile Botox, what could have happened is her lip could have gone lower, but should have lost a lip.
Oh no, don't rolled on in.
Gets thin. Okay, so that's a problem. So then what you do is a combination treatment of
you.
gummy smile Botox and a lip flip. So then you get the thickness and it's lower.
Got you.
So
God,
yeah,
there's so many
thing.
different things you could do.
Yeah, and that's really non-invasive. And if you don't like it, it wears off.
Yeah, that is
go
the
back
beauty
to
of
your
Botox,
own-
to be honest.
Yeah, and it's totally fine. And then the more you have it, like in the first couple of years, the less you're going to need to top it up. So
Interesting.
gummy smiles, you can either... I mean, I don't particularly think they're an unattractive thing. I see a lot of people who think they hate their gummy smile, but it's actually their teeth. And so if I draw with them the design out and I say, look, this is what your smile could look like in the face, and then they do the teeth and I get the gum levels and all that level, then if they look great, then why not show them off? It doesn't matter if it's
Yeah.
gummy. And they actually do. They end up being like, I don't need to do anything with my gum because actually my teeth look
your
great.
teeth, yeah.
It was because my teeth were not in proportion with the fact that I'm gummy.
Yeah.
Like the teeth look small or something like that because of the fact there's too much gum. It's the proportion of pink and white, basically.
Yeah.
That isn't right. So then you can fix it that way. And then some like that patient of mine was obsessed with the gum, actually hated it. So we did something about it. But you don't always have to, yeah. I mean, look, beauty standards change all the time.
Oh, this is
right?
the problem. This is the thing, and
so-
everyone's like, there's a
Yeah.
different. It's almost like flavour of the week kind of thing.
Yeah,
like what
which it
everyone's
shouldn't
doing.
be, because these are not things you can just change next week.
Yeah.
So it's all about that's why I believe in harmony with the face, getting the colours matching with what you should have, getting the size with your face, like all that stuff. Then that's timeless, isn't it?
Yeah.
It's not going to be a trend.
Biggest tip for people to keeping their teeth perfect.
Well, obviously, brush them.
Yeah, please do.
Acid.
Yeah.
So the things we talked about, so brushing well, seeing the hygienist, keeping topped up with your colour if you have to. Things like composite bonding and things that stain, have them more polished, or choose materials that don't.
Yeah.
And then retainers.
If you're noticing any pain, like eating cold things, is that something to be concerned about, or is that just a...
If you get pain on cold, like let's say it's cold liquid, one cause of it is gum recession. So if the gum's like gone up,
Yeah.
it exposes the root of the tooth and things can get in there and feel sensitive straight to the nerve. That's number one. So if there's a gum issue, that should be looked at. Why is the gum recession there is the answer really.
Yeah.
Is it a heavy bite or something like that? Or you've been brushed hard. The second thing is there something else going on with the tooth that's making it sensitive?
Yeah.
And a lot of people don't know that if you have a heavy bite on a tooth, it makes it sensitive.
Got you.
So, because the ligament that holds the tooth in place gets inflamed and the body responds with sensitivity. I guess it's telling you there's something wrong here, by the way.
Yeah. So if you are in pain, don't leave it. Go and see someone for sure.
Don't leave it. And don't rush to do your treatment, because it could be something simple. Maybe it's a little bite adjustment. Maybe it's a change of your toothpaste. You just changed it recently and the other one was a sensitive one that was working well for you.
Yeah.
But get the advice, yeah.
I hate electric toothbrushes. So I was just sitting there thinking
Why
about
they
it.
make you feel weird.
Yeah, I don't like them. It's a lot of vibration in my mouth.
Really?
Yeah, it's too much. I honestly, and so I've tried to not be so aggressive with my bristles. But is it fine to use a normal one?
Yeah.
Yeah, it is fine.
I actually am the same.
Do you?
I prefer
It's just
a
it's
manual
a lot,
toothbrush.
isn't it? It makes me feel a bit dizzy, actually. Where can people find you if they'd like to book an appointment?
So Instagram is a great place. So at dr.samjethwa, they can find me. Our clinic is called Bespoke Smile. We're in central London and in Marlow in Buckinghamshire, which is where you're from.
Where I used to live.
Yeah.
This has been absolutely fascinating. Thank
Good,
you
I'm glad.
so much. And everyone, make sure you're brushing your teeth. Thank you, Dr. Sam.